Hi, this is Mr. Reyes again. We continue our conversation about the venipuncture procedure in Chapter 8. And as previously discussed, you have now selected the vein, you cleansed the site with the 70% isopropyl alcohol, you've let it air dry, you've asked the patient to clench a fist, okay? You selected the vein, you released the tourniquet. And after that, you continued on to prepare your equipment, you inspected your needle. This time, you can reapply your tourniquet. In step 9, we discussed about reapplication of the tourniquet and uncapping and inspected the needle. Once you reapply your tourniquet, you inspect your needle, you ask the patient to clench a fist, okay? Now you're gonna continue with inserting the needle. So once the patient has clenched the fist, okay, you will continue to anchor the vein. If you selected, let's say, the median antecubital area, you have to anchor the vein. What does that mean? It means that you must pull down on the vein so that it remains stationary. If you fail to do this, the vein may move very slightly during the needle insertion, which can cause you to lose the vein or not puncture the vein at all. Now, what we do instruct you is to avoid fishing, right, or doing blind sticks. Do not go in there and reinsert the needle in every other direction, as this may cause injury or harm to the patient, and of course, it will be painful. So do not do that. So it is very important to anchor the vein, and you can do this by holding the vein taut, pulling it down, right, while you're at the same time, your lower finger, okay, is holding the arm in place or supporting the elbow in place. There are some people that like to do what they call a C method. They're holding the vein in this way. As you can see, my left hand looks like a letter C, okay? And they try to anchor the vein by holding the vein, pulling it up and pulling it down in the same place. However, this can be very risky as you can accidentally puncture your finger, right? Or your hand. So please make sure to anchor and do not anchor right where the site is. You have to go at least 2 inches below the puncture site. So I'm going to puncture here. Make sure that your hand is way below here to give you space to come in with the needle. All right. So please make sure you anchor nice, at least 2 inches below the puncture site so you have room to insert the needle. All right. So you ask the patient to make a fist. You anchored the vein. Now you're going to come in with the needle. You're going to insert the needle with a bevel up. All right. And you're going to come in about 30 degrees. All right. Now, this would be about 45 degrees. Okay. So you want to come a little bit shorter. Now, there are times when some patients have they're a little thicker arms. Okay. They have more adipose tissue. So the veins may be a bit deeper. So in this case, you could probably go a little bit higher, but not too much. Maybe 45 at the most. So, but 30 degrees is the ideal recommended angle of insertion, okay? So you're gonna, in one stroke, you're gonna insert the needle into the vein. Now, if you introduce the needle into the vein and you change your mind and you remove it, that needle is considered contaminated and you will have to remove the needle and use a brand new sterile needle, okay? So again, remember, anchor the vein, all right, using we call the L method, okay? This would be more like an L, okay? By anchoring down on the vein, it will hold the vein stationary. This is one of the most common errors that new phlebotomists make and students. When they anchor the vein, they fail or they forget to anchor the vein or they don't anchor it enough, okay? And the needle or the vein will roll ever so slightly and the needle will be right beside it, okay? Now, if that does happen to you, you can always retract the needle very slightly without taking it out and redirecting it along the pathway of the vein. That's why I said earlier, when you palpate for the vein, make sure that you follow the path. See this vein right here, it goes this way, okay? I'm not going to insert the needle this way, okay? Because I will go right through it. I will infiltrate the vein. So what do? I would have to come back and maybe move the arm alongside and go in the direction of the vein. So it's important to remember that, okay? That's another common mistake. Now you're not going to insert a lot of the needle. It's going to be maybe 1/4 of the needle, if any. Once you insert the needle, you're going to start to see some a blood return in the hub of the needle if you're using a syringe, okay? But with the ETS system, you're not going to see it. So you're going to have to trust your skill, okay, your instinct that you are in the vein, okay? So again, please make sure that you insert the needle as instructed. Now, the next step, step number 11, you're going to establish blood flow. Once you are in the vein, okay, you're not sure if you are in the vein or not until you insert a tube, okay? When you insert your first ETS tube into the tube holder or the multi-sample needle, all right, you're gonna see blood come back in, rush right away, okay? Or you may not. Let's say you do. You see blood gushing into the tube, okay? It's filling from the bottom up. Remember, this is what you want to have the arm, the position of the arm. So it's filling from the bottom up, okay? If you do that, if you see nice, good blood flow, you may release the tourniquet at this point. However, there are some older patients that have very poor circulation and it's very hard for the tubes to fill and they may fill very slowly. So it's acceptable for you to leave the tourniquet on until the last tube, which is something we see often as well, all right? So again, insert the needle. If you insert the tube into the tube holder, please make sure to hold the tube holder nice and snug to the skin, because if the tube holder is moving around, the needle that is inside the arm is going to be moving around, causing pain. So remember, the tube holder must be making contact with the skin, or you're going to be securing it nice and firm where the tube holder is not moving, okay? So you insert the tube, you can put it in and push it in and twist it in a clockwise motion so the tube can go in. Hopefully you have your tubes in the right order of draw so you can collect these, okay? So it's super important that you prepare your equipment, your tubes in the order of draw. That way you won't make any mistakes and cause any carryover or contamination of your specimens, okay? So once you insert the tubes and you see blood flow again coming in, go ahead and release the tourniquet and continue with collections of your tubes in the order of draw, okay? At this point, the patients should have their hand open. There's no need to make a fist anymore, okay? So they can relax, right? Now, remember also, keep an eye on your patients. You're looking down, you're so focused on your blood collection that you may forget to observe the patient. Are they doing okay? If you see them that they are maybe starting to faint, or they start sweating, or they don't look right, you must stop the procedure right away. Regardless if you're in your last tube or in your first tube, it doesn't matter. You must stop the procedure immediately and attend to the patient, all right? We'll talk about complications of the venipuncture procedure in another section, okay? But for right now, please make sure that you follow these steps in collecting your specimen. So we covered step 10, okay? And step 11, establishing blood flow, releasing the tourniquet, and asking the patient to open their fist, all right? Now the last step I'm gonna cover in this section is filling, removing, and mixing your tubes, okay? So again, fill your tubes, let them fill, once you establish blood flow, let them fill on their own until they stop completely, okay? Now when you're going to remove the tube, you must make sure that you hold the needle in place, because once you pull that tube, the needle can accidentally come out. And it happens very often because many times when you go in with the needle, you go in very, very slightly. That what happens is that any little movement back will bring the needle out and you will lose your needle, okay? And of course, you will have a very unhappy patient and you will have to puncture them again, okay? So again, make sure that that tube holder doesn't move, that the needle stays in place to avoid any further pain, and continue with filling your tubes, okay? As soon as you remove one tube, remember to invert the number of times recommended for that specific tube, okay? You should do it at least minimum of 5 times each and average about 6 times each one, okay? You put them in your tube holder, okay? And you follow with the next tube and do the same thing. Put it in, let it fill completely, and then remove the tube, invert it, mix it, okay? And put it in there. If you're using a syringe, again, this is probably because you may only need 1 or 2 tubes. Syringes, which are 10 mLs, will only give you enough blood for about 2 to 3 specimens at the most, okay? But again, remember, you cannot underfill tubes, all right? Remember the ratio of additives to blood, especially with the light blue tube, okay? You must fill those tubes completely. So if you use a syringe, make sure you have enough blood for all the tubes that you need. So you may even use a 20 ml syringe, which should give you enough for about 4 tubes or more, okay? So again, collect your tubes, invert them, and place them down in usually a small rack that you might have there, okay? After you've collected all your specimens, okay, we're gonna continue on the next step, as to what you do. Okay, so hold on, we'll be right back.